Okay, so let's see. Hi everyone, Oksana here. Hi everyone, Oksana here. Let me know that you can see me and you can hear me. On this video, I'm gonna answer some of the questions. So let me just check to make sure my audio is working. Okay, let's see. Let me see. So if you have any questions for me, you can message us more info. But remember that every person who comments on a post, or if you would like to request more info about how we can help you, then make sure that you see a message, because a message can come through as a requested message. So make sure that you are seeing that. Okay, I see that my audio is on. Great. So I'm going to answer some of the questions. So the first question that we get asked is, uh, doctors will often tell you that if you have a thyroid disease that's causing you to have low thyroid function, you will have to stay on medications for the rest of your life. However, that is not the case. We helped many people not only reduce the amount of the thyroid medication that they taking, which means that their thyroid function improved within 6 weeks, but we also had clients who were able to get off their thyroid medication completely because their doctor told them that they no longer need to take their thyroid medication because their thyroid fully recovered and was able to go back to normal function after a decade of struggling with Hashimoto's disease. So that's the first thing to understand, that we have experience helping people repair the immune system that's causing you to decrease your thyroid function and become low in thyroid, which is hypothyroidism. So unless you repair your immune system will continue destroying your thyroid until your thyroid is gone, and then your immune system can go and target something else. So this is why, regardless of whether or not you're taking your medications for any type of autoimmune disease or thyroid disease, it's still important to learn what you have to do to repair your immune system and give your body enough tools and nutrients to allow your thyroid to be able to function optimally. And we do that all without the supplements. We had a client that we worked with, uh, Todd, who was spending $600 a month on supplements, and he was not feeling any better. He was taking peak thyroid medication. He was taking a lot of different supplements for his pain and symptoms that he was experiencing. But we helped him become not only symptom free in 40 days, but also he no longer needed to take the supplements anymore and did not need to take thyroid medication. So there's a lot of people who tell you that they can help you with your disease or kidney disease, but do they have results like we share on this page? And what you can do is you can go to a page, Viktoriya and OKsana, and look through the photos and look through the videos and how we helped other people with all types of diseases and different types of cases. So my camera is over there, but I'm actually looking at the screen. So let me know if you have any questions about that. And the second thing that's really important is, even if you take in thyroid medication, what we see often happen is people come to us, they had Hashimoto's disease for 20 years, and then they got diagnosed with another autoimmune disease. So if you get diagnosed with another autoimmune disease, it means you're not healing. The diseases keep progressing. You don't continue getting more diseases if you're doing all the right things for your health. Okay, so we worked with a client who had Hashimoto's disease for 20 years, and then all of a sudden she was diagnosed with esophageal dysmobility, so she could no longer swallow, and the doctors put her on a feeding tube. She lost around 20 to 30 pounds because she could no longer eat. She had to be in the feeding tube. They fed her chemicals through the feeding tube, and when we worked with her, she started seeing improvements in her lab work. Her antibodies started reversing. Her thyroid actually improved in function, but also she was able to get off her feeding tube eventually, and she saw many other improvements. This was a few years ago. So another great thing is that she was able to walk. She was very fatigued. Her energy has improved. Her skin improved. She actually got diagnosed with scleroderma disease after having Hashimoto's disease for 20 years. So we were able to help her. And if you would like to see that video, we of course have it published too, where her daughter shared how we helped her mother see those improvements. So that's one thing I wanted to talk about. Another thing I wanted to talk about is there's somebody we spoke with who wanted to get a help with her disease, and she told us that she has seen doctors from Harvard who told her that she no longer has Hashimoto's disease. But when we looked at her lab work, she still tested positive for Hashimoto's disease. She still had Hashimoto's antibodies. And then a few years later, she got diagnosed with myasthenia gravis. Realize that myasthenia gravis, we don't have many people come to us with that disease. She was the only person we ever spoke with in a decade of our career who had both Hashimoto's disease and myasthenia gravis. And when she went to talk to her doctor told her that her disease was progressing so fast and there's really nothing they could do for her. And so this lady wanted to work with us, but we couldn't take her into the program. We were booked for clients at the time, and she got really upset and made up some things about us online, which were not true, because she was upset that she couldn't work with us at that time. So unfortunately, there's always people who either make things up, who never worked with us. So, but we could have helped her had she reached out to us earlier, and actually we gave her clarity that some of the doctors basically lied to her, telling her disease was gone, but it wasn't according to her blood work. So that's one thing I want to talk about. Can you repair your thyroid function? We have a post about that. So again, if you have any questions, let me know in the comments below. Let me read through some of these questions. Let's see, how we can help you. We can go to our website, but of course you can message this page and we'll respond to you. And if we respond back to you, make sure that you check message requests, because you might not see that right away. I actually don't see any comments on my screen. So another thing I wanted to share, I just sent an email, and if you're not in a mailing list, one of our clients we worked with who had rheumatoid arthritis. She is a PhD student. She was actually doing her doctorate degree while we worked with her, and she had lupus disease, and her mother was suffering with scleroderma, and her symptoms improved so rapidly. She barely had any joint pain, and her mom, who had scleroderma, improved so well that her mother no longer was taking any medications for her fatty liver, so her liver inflammation has reduced. Her mother's skin on her hands has also improved because scleroderma can harden your skin. So her mom was really excited, and actually our client's rheumatologist was so excited about her results that she wanted to publish a case study on her. Okay, so that was really exciting. I just sent a newsletter. So one thing I wanted to share with you is that we have a course, a $47 course, where you can learn some of the education that we teach for our clients who work with us one-on-one. And there's something that we taught recently. There was amazing how you can use nutrition to improve the function of your nerve cells and your brain cells, and also reverse diseases such as dementia or brain degeneration that happens as we age. And this is a class along with other classes you can purchase for only $47. We can put a link below this video. You can message us for the link. And in that video, we also talked about, we share incredible study that was done over several years, and it was called the multiple sclerosis scheme. And it was a really long study that actually proved that nutrition makes significant differences in improving a condition, multiple sclerosis disease, compared to taking medications. And it was published in scientific journals where drug industry actually, the people who were taking drugs for multiple sclerosis actually got worse and sicker than the people who were not taking that medication. And this is a study that was published in journals, and it was an incredible study. If you want to learn about it, then I can send you the link. And it basically talks about how people who improved their diet were doing so much better than people who were just taking the medication. And then incredibly, that study that was done by scientists also showed that even if you don't change your diet, people were doing better off than people who were taking that type of medication specific for multiple sclerosis. So that's really incredible. So the bottom of the story is that people are completely better off knowing what they have to do to improve their condition through nutrition. But of course, if you've been doing your nutrition, you're not seeing results like majority of our clients are seeing, then reach out for help so we can tell you what are the things you're doing wrong or not enough of. Okay, so let me go through some questions I have here for you. And again, if you have a question, let me know. Let's see, what are I? So we talked about, can Hashimoto's be reversed? What if your thyroid is already gone? What if your thyroid is already destroyed? We talked about that it's still important to learn how to stop the autoimmune disease from progressing, because once your thyroid is gone, then your immune system can find another target. And another thing I wanted to address is your immune system is very important to help you fight cancer cells. And when your immune system is busy attacking your body, then your immune system will not be able to find those cancer cells. And that's another benefit you get from learning. The education that we teach a client is really life-changing. It's not only helping you improve your health long-term, 10 to 20 years from now, but it's decisions that you make right now that's going to affect your future. And you're going to have a much better future if you learn the right things and instead of trying to do things on your own that haven't been working for you. And we also even had clients who were taking medications. They couldn't get pregnant because their body was not healthy. They were able to get pregnant in their 20s, in their 30s, in their 40s. We had clients who had hormonal issues that normalized. We had clients in the menopause who were having hot flashes 30 times a day that went away. And so it benefits the whole body. Okay, let's talk about, Viktoriya, what question should I answer? Okay, let's see. So actually let me go through, look at my phone, because I can see on my phone the questions. Let's see. And of course, if you want me to do another video during another time, last time I went live was 2 days ago, but we haven't gone live on this page in months, if it hasn't been a year. But if there's something that you think is going to be helpful to you to learn more about how we're helping people, give you an opportunity to get to know us, as well as to ask your questions, and let me know what is the best time that you can join live and ask questions. Otherwise, let me see if I can. Islam asks, may you talk about alopecia universalis, the cause, the way of treatment, the period of treatment? So that's a great question. So we had clients who lost all of their hair because autoimmune disease can destroy the hair follicles. And we had a client who had, again, it's a similar story. She had Hashimoto's disease, and then she was diagnosed with alopecia, and all of her hair fell out, so including hair on her eyelashes, her eyebrows. And she tried different steroids, diets that weren't able to help her. But when we worked with her, we helped her figure out what are the things she was doing that were healthy, but they do not help you heal the inflammation rapidly, or maybe what are the things she was not eating enough of. So after we worked with her, her hair started regrowing in 2 weeks. She started getting fuzzy hair on her scalp, and then after a year she sent us an email. It was about a year, and she told us all of her hair regrew, and she no longer needed to take any of her medications, including medications for her thyroid. So the question is, what are the causes? So there's, of course, there's autoimmune disease cause, there's a genetic cause, and there's an autoimmune disease cause. So with the autoimmune disease cause, it's your immune system that destroying the follicles until they're gone. But we had people who had bald spots, but they were able to regrow those bald spots and also remain having hair on the scalp, because they continue implementing what we teach them in the program. Because what we teach you is how to maintain your healthful life. So can you get sick again? You can get sick with diabetes. You can get sick with cancer if you don't treat your body right. But everything we teach you is science-based, and we know it works because it helped people not only improve their symptoms like joint pain or hair loss, but it also their autoimmune markers improved. So the question is, if it doesn't work, why are their autoimmune markers actually reversing, which means you're no longer producing those autoimmune antibodies, or those antibodies die off over time. So if it did not work, of course, we would not be seeing that in the blood work, but we're seeing that because our clients are working with us. They're not doing other things that may have affected their blood work. Does this make sense? So it's an immune system dysfunction. There's many different triggers. Our genes get triggered for diseases. It's triggered through the lifestyle. Of course, nutrition we consume. We either eating the foods that are causing the damage. Even if you don't have any symptoms, the damage can come through as heart disease, as diabetes later in life. My grandfather died from prostate cancer. My grandmother died from stroke, and she drank a lot of alcohol and didn't take care of her diet, and she got stroke and she died. And then my grandmother on my mother's side, again, we grew up on the farm in Ukraine. We ate food that we grew ourselves. We ate very healthy. We didn't eat processed foods. Our grandma, most of her life, she died when she was almost 90 years old. And this because she grew up in a different environment. Most of the people who are our age, who named 30s and 40s, if you grew up in the United States, you grew up eating completely different food. You grew up eating chemical food. You grew up eating cereals. You grew up eating processed foods that are, even if it was potato, it was not the type of soil that our grandmother, that she had in her farm when she planted her potatoes. Okay, so our grandmother was eating better food, but she still was died from shingles. She had shingles, but also she got really sick in the last 15 years of her life. But the reason why she was able to live so long is because the food she was eating was significantly different than the food we eat in the United States. Even if the food is organic, it's not the same nutrient-rich foods like it was 50 years ago, especially if you have your own farm. Our grandmother had her own farm. Everything she ate came from her farm. Okay, and we're not going to be, it's not realistic for us to spend all day on the farm and grow our own food. That's not going to happen. We have to eat the food that we get from the grocery store. But we had clients who did not eat organic food. We had clients from India who worked with us. They don't have access to organic food. We have clients who did not speak any English work with us because their daughter translated the program for them, and they were still able to see improvements. So even if they were not eating organic, because the foods that you're eating is more important than whether it's organic or not. Of course, organic is better, but not everybody has access to that. So there's many different reasons why people get sick, but it's a combination of different things that trigger our genes for disease, and over time we get a final trigger. And Your body always tries to heal itself, whether it's from cancer, from chronic inflammation. But if you don't have the right nutrients, it's not going to have enough tools to create healthy cells and trigger those genes that help you fight diseases. Because also genes that help you fight illnesses have to be activated, and it happens through every cell division. So our cells divide and you create healthy cells with every cell division, or you continue creating sick cells with every cell division. And most of the people who already have autoimmune disease, they're so malnourished and deficient that whatever nutrients they're consuming, their body is using it to help you fight disease. So it's not even enough to help you repair the body. So let me see. My sister wants to answer your question with more information. Dale, hello. Hi, Luba. She asked to talk about Sjogren's disease. So Sjogren's disease, it affects your salivary glands. And what often happens with the disease is people get symptoms of dryness. They get dry eyes. They get dry mouth. The internal organs can be affected. They have issues digesting the food because everything just dries out, and like swallowing issues, constipation issues. Of course, people with Sjogren's can also have joint pain. We had a client who's a nurse. Her video is really incredible because she's a nurse. We helped with her Sjogren's disease. She got diagnosed very rapidly and suddenly because all of her life she was an athlete. She was really eating healthy. All her family members are doctors, and her doctors who are her family members couldn't help her, and she got diagnosed very rapidly. She was very upset because all of her life she was healthy athlete. She's a nurse. She took care of her health, but she started experiencing a lot of joint pain, dry eyes. She was taking drops for her eyes, and I can even find you. She had a lot of different symptoms. But again, it's an autoimmune disease, and in 21 days, she became symptom-free in a program, and she was able to run a marathon. If you want to know what symptoms she had, I have to go back. Again, it was several years ago, so I don't remember all the symptoms. But so Sjogren's